Hi again. Okay, I'll be waiting until just 4:01 on my clock and then we'll get started here. All right, it is 4:01. So welcome everyone on this Wednesday afternoon. Thank you all for joining us for the Rockefeller Foundation's Communications Community of Practice series. For those of you joining us for the first time, I'll give a very brief introduction to this community and what we're all about and what we hope to accomplish together. For those of you I haven't met, my name is Nina Chung. I'm a senior associate at Hadaway Communications. I'm joined by Caroline Jaros behind the scenes here. And we and our team at Hadaway serve as the secretariat for the STAT communications community. This community grew out of the work of the State and Territory Alliance for Testing, or STAT, a group of states and territories convened by the Rockefeller Foundation to collaborate and join forces as the pandemic gained steam. So for over a year now, the STAT community has been sharing hard-earned insights, best practices, and successful strategies and lessons learned about testing, vaccination, and all aspects of the COVID-19 response across the country. The goal for expanding this webinar series more publicly is to bring that same spirit of collaboration that made STAT such a strength and asset to our nation to the broader community of people working on COVID communications, which, as we know, is essential for buy-in for all public health measures. A second motivation for this series is to bring the same rigor and commitment to creative and scientific solutions that inform other aspects of the response to strategic communications. So we are very excited about today's conversation on Vira, a chatbot designed to support and meet young people where they are with simple answers to their most common questions around the vaccine. We're joined today by Dr. Naor Barziv, Associate Professor in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health, João Sedoc, Assistant Professor of Technology, Operations, and Statistics at the NYU Stern School of Business and Adjunct Engineering Professor at Johns Hopkins, Rose Weeks, Director of Communications at the International Vaccine Access Center, and Sandra Dobson, Ambassador Coordinator for the Value Project at the Baltimore City Health Department. Welcome to you all. Our speakers today represent the masterminds behind this creative AI-based solution to support positive behavior changes in young adults specifically. We'll be hearing from them on the role this technology plays in rapid real-time communications response, how it allows a two-way information flow between the public and health agencies, which, as we know, is critical in crisis, and the unique development and use of this particular chatbot among frontline health workers in Baltimore City and other urban communities. So as a last housekeeping note, we encourage you to leave your thoughts, experiences, comments in either the Q&A box or the chat box. If it's in chat, please select the panelists and attendees settings so that we can all learn from each other. And Caroline and I will be gathering questions as we go for the Q&A at the end. So with that, I will hand the mic off to Dr. Naor.
Nina, great to be here, and thanks to everybody for participating. It's lovely to be able to discuss our resources with you, and we hope that they can be of benefit in your daily practice as well. And we very much would value feedback as well and your thoughts. Today, I'd like to present mainly on our chatbot, which we've called Vira. So perhaps we can just move on to the next slide. So here at the International Vaccine Access Center, which is based at the Johns Hopkins Bloomberg School of Public Health, we've developed a number of resources for health departments and for outreach workers for practical day-to-day use during COVID-19 vaccine rollout in the United States. And the compendium, which is the first one on your left, is a series of self-paced learning modules, and they include how to communicate about vaccines. And so the website is there, and we'd very much welcome for you to go in there and look through the resources, and in fact just give yourself an opportunity to refresh or to get further training on how best to communicate with the very many questions that are out there in the community, very valid and important questions. The second resource is the resource hub. It's the second one in the middle there with the website shown. And again, it's an FAQ style interactive compendium, both in the English language and in Spanish, that gives evidence-based answers to very commonly asked questions. And the third one, which is what we'll be focusing on today, is the chatbot. And the chatbot is, in fact, all of the chatbot and the resource hub and the training compendium were supported through the COVID-19 training initiative at the Johns Hopkins Bloomberg School, and was funded through Bloomberg Philanthropies, and we're very grateful for that. So I want to talk about why it's important that we develop the chatbot. What's the purpose of the chatbot as opposed to just the compendium? So the first thing to recognize, I think, in the context of the pandemic, and perhaps in this pandemic more than in any other major public health disaster in the past, has been the important role of misinformation. People are no longer trusting of what information is given to them, and it's very difficult for people to be able to distinguish fact from fiction, what's misinformed, and what in fact is overtly disinformation, an attempt to sway the public away from evidence-based decisions. So it was important that we made a resource that was available at all times, that was able to present best practice and the best evidence that is available, but to do it in a way that carries a specific set of advantages. Obviously, everybody wants to talk to the experts and talk to people who know and talk to people who they trust. And not everybody is always available. The demand for that kind of conversation is very high, and the ability to provide for that demand is limited. So the purpose of the chatbot, in a sense, is that it can be a self-service tool. People can go in and ask their own questions, and they can access it anytime, 24/7. And they know that they're going to get access to the best available and up-to-date evidence. It's scalable, so it can be used by the whole of the US population, if you like, simultaneously. It can be used by anybody who has access through a smartphone or a computer. And it's user-centered in the sense that people ask what they want, and they are efficiently given the information that they wanted and that they need to know, and that's relevant for them, rather than having to trawl through long lists of questions until you find a question in an FAQ that perhaps is somewhat similar to what you wanted to ask, but it's not exactly what you had in mind. This very much focuses on the person themselves and what their questions are. We hope also that it's a fun experience and entertaining. But perhaps the two most important features, which are the ones on the right-hand side there in the column, is that we've learned as we've developed this chatbot that people find that chatbots are non-judgmental. They're not worried about asking questions that might be silly, or they might be worried but too embarrassed to ask. People ask whatever they want when they know that it's a chatbot. They feel that they are free from kind of criticism, and that's, I think, a really important thing, because it brings out people's real concerns. And the other really important thing, and I hope we get to emphasize this throughout the talk, is that unlike just an FAQ or a website that disseminates information in one direction, this allows for listening to what users' concerns are. We are able to collate the many questions that are asked and see how those questions change over time, see what the predominant concerns of people are at any time, and be able to address also new concerns that are emerging for which perhaps answers have not yet been written. But people are at the cutting edge when it comes to the uncertainty around the science and the policy. And we can pick up those questions early, we can address those questions, we can populate the chatbot with the correct answers to those questions, and so the cycle continues in an iterative way. So the chatbot is responsive to community questions and community concerns. Next slide, please. In a way, we've also been fortunate and unfortunate that we've had all of this social distancing and isolation and so on. But one of the advantages, at least technologically, is that it's really advanced and accelerated the use of chatbots. Chatbots have been developed by a number of organizations. The WHO has a chatbot, which is a much more simple design, but has huge reach with the potential to reach millions and millions of people. There have been some chatbots have been designed in order to save staff work time, in the ability for people, as I mentioned before, about self-service, even self-diagnosis and support through concerns about self-diagnosis can be done by chatbots, and with a high degree of accuracy as well. And in addition to questions about COVID itself, there are also flow-on effects from isolation and from illness and from loss of family members and so on. And the pandemic has taken a very major toll on our mental health as a society and as individuals. And chatbots have been used to support those concerns as well, with support for mental health services and anxiety. So there are a number of such services out there. Next slide, please. So I'd like to just briefly, very briefly, just introduce you to the chatbot. I think we've lost the screen share, or at least I have. Yep, great. So we've named the chatbot Vira, which stands for Vaccine Information Resource Assistant. We aim for it to provide trustworthy, reliable information in a fun way that is user-directed and that listens to users' concerns and collates their concerns as well. So as you can see in your screen, Chatbot suggests some questions to get the conversation going. So perhaps we can just click on any of those questions and see where it takes us. Great. So what can you tell me about COVID-19 vaccines? And the chatbot Vira thanks the user for their question and reminds them that she's just a chatbot, it's just a chatbot, and people need to understand not to take personal medical advice from the system and the terms that are referred to. And then the Vira responds. Now, in fact, it's very important that we get feedback from users on a per question basis. So if we're happy, let's say we were happy with the answer, and we give it a thumbs up, then the conversation can carry on. And if I'm not sure what to ask, perhaps I want to go down and look at the featured questions. So I click on those featured questions. Great. And perhaps we should say, let's pick, should people that already had COVID-19 get the vaccine? That seems to be a common question at the moment. And we get the response almost instantly. People who had COVID-19 infection will have immunity for a period of time, but we don't know how long the immunity lasts. A vaccine will help ensure that you're protected. So that's good. So let's say I'm happy with that. Let's give that a thumbs up. But I want to know a little bit more about how long immunity will last. So what if I say something perhaps a little bit ambiguous, perhaps I'm typing quickly on my phone. Let's say, how long is immunity? Let's give that question. Let's even misspell immunity with one M or something. Okay, we can do it with two M's, that's fine. So the chatbot says, we know that people vaccinated will have protection for at least about a year. And no matter how long immunity lasts, your best form of protection is getting vaccinated. If it wasn't exactly what I meant, perhaps my question was looking more at how soon after I receive the vaccine will I be vaccinated, or perhaps I meant something slightly different. So I can always give the chatbot a thumbs down. And if I click the thumbs down, then the chatbot suggests a related set of questions. And we can pick the question that we like. For example, let's pick the second one. And then we get a response. And so again, the conversation can roll on. And as it does, when not only are we collecting information, anonymized information, but information about what are the questions of concern out there, we also see how long the conversation goes on for, how in depth the questions are delved into, and so on. And then we do a feedback session at the end if people want to participate also. There's a way of doing that also. So I think with that, I'll hand over the talk, but thank you very much for joining us today. And we'd love for you to play with these resources and give us feedback. Thank you so much.
All right. Great. So I'm going to talk to you a little bit about the AI technology behind Vira. So this is in collaboration with IBM Research in their project debater team. And so the first thing that happens is the user will go to WhatsApp or the website and they'll input some text. That text comes to the AI intelligence component. The first component that we do is we basically go and we understand what the user's intent is. So an example of an intent is, let's say, a concern about COVID-19 vaccine. That's a typical intent. Another intent could be to say hi, or just chit chat type of intent to open the conversation, or let's say goodbye to end the conversation. So the first component that we start with is understanding what is the intent of the person as they talk to Vera. The next component after that is basically the dialogue manager. The dialogue manager is the one that the component that really understands the full conversation and is trying to manage the conversational flow. If we see that there's a concern about the vaccine or a valid user concern of some sort, that we believe is within the scope of Vira, then the next thing that we do is we go and the dialogue manager hands that off to the IBM debater key point analysis model. This is a deep learning model using actually state-of-the-art artificial intelligence to try to then understand, given what the user's concern is, let's say something about how long immunity will last, and it will map that onto a key sort of question that users are asking. That then relates and goes back down to this response database, which is populated by Noor and Rose's team, and they've created a whole bunch of answers to these key points or key concerns that are coming from users. And in turn, we have a key point response. And this is sort of a crux response. And then finally, that response database links to several answers, several possible answers that we could give back to the user for that specific key point concern. If it's matched beyond a certain threshold, then that comes back to the dialogue manager. And the dialogue manager will take the user intent as well as the various responses that are coming back from the key point matching algorithm, and will decide which set of responses it's going to choose, and also put some canned components of text along with that. And that will then be passed back to the user. So that's basically the mechanism of how Vira works. And this is actually sort of elaborated through. And so as we go through the cycles of having conversations with people, one of the things that's very important is that Vira doesn't know all the answers, right? And so the next question really becomes this sort of idea that Noor talked about regarding a two-way conversation, not only between a person and Vira, but also between Vira and us, in the sense that we want to discover, okay, what are new emergent questions? What are questions that we don't have answers to in Vira at the moment? So next slide, please. And so what this component does is basically we also use the same key point mechanism that's part of IBM's system to actually go and understand what these key questions are. So the user mentions a question, and we try to take that concern and map it on, but sometimes we have concerns that we didn't anticipate on. And now what this system is trying to do is trying to understand, okay, is this a new concern that we should be addressing and add answers to? So for instance, here's the first example at the top, which is, can the vaccine cause blood clots? And then we see that matches within our system in the response database to, I'm scared about blood clots. And now, since there isn't a perfect match, the next thing that we do is we look at other conversations and we try to see if there are other questions that are similar to this question. And so we then can see, like, I'm at higher risk for blood clots. Can I get vaccinated? Should I be worried about blood clots as a result of vaccine? Does the vaccine cause microclotting? So these are all now deemed similar to the question that the user had, which is, can the vaccine cause blood clots? And the next column shows, okay, how often did users actually give a thumbs down when we gave the answers to this question? So you can see roughly 26% had negative feedback. And then finally, after review, we decided, okay, this is not a new concern. Now, if we go to the second example, which is how many breakthrough infections are happening, you can see that at the time, the only key point that was matching to that was, do vaccines work against mutated strains of COVID-19, right? And in fact, if you look at the clusters, you can see that people are asking about the breakthrough rate of Sinovac, how many breakthrough cases there are. And you can also see from the negative ratio feedback comment that we're getting a lot of feedback that, oh, this answer isn't right. And so after review, a new key point was created specifically for understanding and responding to questions about breakthrough infections. So next slide. And the way that we do this is by really using this thumbs up, thumbs down information that Noor talked about. We're able to not only see a particular question, but we're able to look at a set of key points that are being matched. And we use all of this feedback from the user to understand whether Vira is doing something right or wrong, how we can improve it, what are the important concerns that we're looking at, and also what are the emergent concerns. Next slide, please. So just looking at some usability findings from the feedback from users. So one thing that we can see is that the system is responding to users 100% of the time. This is very important. You can see, we always respond. Often we'll say, well, we don't know, or can you please rephrase that? But we're responding 100% of the time. Of that 100%, we can see that the overall positive feedback is roughly 71%. Now, the second row about key point-based responses is a very important one. So what this says is, do we understand or do we identify the intent that the user has as a concern? And do we think that we can find an adequate key point-based response from our response database to answer the user concern? And this is above some minimum threshold of confidence. And so when we do that, and we're able to do that, we see, okay, we get a thumbs up or positive feedback 96% of the time. Now, on the other hand, when we see that there's either a thumbs down, or let's say we don't have anything above threshold, then what we do is we go and we say, oh, okay, we don't understand that, right? And of those times, often we'll either get a thumbs down or the user will rephrase. And then given that, we offer the most likely responses given the key point matching model algorithm. And we'll say, okay, here are the top 4 questions that we think are correct. And when we do that, we find that roughly 87% of the time, people are giving positive feedback after they've clicked on the study. So I must say that this is also with crowd workers, our positive feedback ratio is slightly lower with general population. Okay, next slide, please. So the next thing that we're working on is understanding trust. So one of the key components between the user and the chatbot, right, between Vira, is understanding and differentially responding to the user. And so there's a bunch of different types of users, and what we want to do is make sure that we're appropriately responding. So we've differentiated trust into basically 3 different categories, and then not of all 3. And so there's low trust, and that's low trust towards Vira, the chatbot, low trust towards the vaccine or system in general, and then high trust. So an example of low trust towards the vaccine would be the vaccine will kill me, right? Here, the user is basically displaying low trust, and so we want to be able to respond differentially to that. Similarly, we can see an example of low trust towards Vira, which is you're lying to me about the vaccine, right? In that situation, what the user is saying is that, okay, I don't trust the chatbot, and so we want to also differentially respond in a way that can increase the trust of the user. And a final example is extremely high trust users who may be coming to Vira to convince someone else or to find another answer to their question. And so, for instance, an example of that is, can I go to CVS and get a third vaccine shot as a booster, right? So that's kind of an example, and what we're trying to do with Vira, with the next iteration of Vira, is really be able to identify such users and what they're saying, and differentially be able to respond to them in a way that will hopefully give them the right answers in the appropriate style. Okay, and with that, thank you for listening, and Rosa, I think you're up next.
Thanks, Xiao. I'm going to talk about 3 primary use cases that we're seeing for Vira right now. And so the first is frontline health workers and those doing vaccine outreach, often in partnership with health departments. So we designed Vira with iterative input from frontline health workers, and so we're really thrilled that they're among our early users. And you'll hear more about how that kind of work is going with our next presenter. So I'll move on to the second use case, which is clinics and hospitals. And so clinics and hospitals have been overwhelmed by calls. Their call volume has skyrocketed during the pandemic, and they're desperate for a solution. So they've put a link to the chatbot on their homepage of their clinic. Oftentimes these are clinics serving large, low-income patient populations. They don't have the resources to really staff to handle the call volumes. And so we're, as a next step, providing them with an embeddable version of the chatbot, so they don't have to send people off their website. It will be placed on their website, and users can ask their questions and then hopefully schedule a vaccine appointment without going anywhere off the website. The third use case that we are describing here is WhatsApp. We were approached by Facebook to integrate the chatbot into WhatsApp, and we are very hopeful this will be taking place in the next few weeks. This will allow us to reach users. They have 100 million users in the United States alone, without people going off, again, the environment they're already interacting in. So that will be information provided in English and in Spanish. And I just wanted to also acknowledge that we're excited to be working with the Made to Save Coalition to outfit their network of volunteers and ambassadors to reinforce the latest vaccine facts with the chatbot. In terms of our user engagement and usability study, we're looking really carefully at our target population, which is, again, health workers, people doing vaccine outreach, and young people in urban mid-Atlantic American communities. So we're doing a series of qualitative research activities, focus groups, personality and demographic questionnaires, interviews, and a usability questionnaire. We're trying to find out, is the chatbot accessible, appropriate, and accepted by target audience members, and if the chatbot is considered to be useful and trustworthy by the target audience. So as an example of how the focus groups have gone, we will show a typical question from people who are concerned or have questions about COVID vaccines. I'm young and healthy, so why do we need to get the vaccine? We'll show them 4 different kinds of responses, and we'll ask them to rank what their top favorite is and explain why. And what we're doing here is trying to find out what parts of the messaging are problematic, maybe potentially too technical, and also maybe could be inappropriate in some ways. So what across the board is not working, what is working really well, and then if there's variation in the demographic that we're working with in these activities. So across the board, it's not present on this slide, but we did show some humorous messages, and we heard loud and clear humor was not appreciated in a chatbot environment. It came across as rude. Any sassiness came across as very inappropriate. So we have taken that into account. It was a major lesson learned for us. In terms of where there's variation, we're looking really carefully at people's responses to the empathetic messages, where the chatbot will say something like, a lot of people ask me that, or that's a great question. Here's what you need to know. And so we expected more people to respond to the empathetic message. We know that empathy is really important in vaccine communication. Reflecting people's comments is a good way to get people to open up and talk more. We did find that some people really liked it and some people found it annoying, and they just wanted the facts. They just wanted an answer. And so what we think is, as you saw with Joao's presentation, we think that those are the high trust users, and the low trust users maybe do appreciate more of the empathy. So what we're doing is an analysis to see if we have a preliminary association there. We also had a rational argument referring to community benefit as one of the types, and that was another one that had a disparity. And a lot of people liked that kind of more of an argument from the chatbot. And some people found it to be pushy, and we're going to see if there's an association with people's demographics. In terms of our response from the community, from those we worked with, in terms of usability, the strengths they found when it came to getting information about COVID-19 vaccines from a chatbot were, it was dependable, it offered detailed information, it provided quick information, and also this facet of it being a non-judgmental outlet. And the quote we felt that was very illuminative of this perception was, sometimes talking to someone can be a little scary. In terms of the weaknesses of the chatbot, as people have been saying, the chatbot doesn't allow for customization. At the moment, it doesn't have the patient, a patient's medical records. It doesn't know about medications or underlying health conditions. So it can't be as customized in the kind of advice it provides, or the information it provides. There's also no human in the loop to provide information. So people have an expectation that with commercial chatbots, if you're not getting the information you want, you say, I want to talk to a person, please connect me with the person. And we're looking at whether we can do that as a next step of our project. In terms of the design, we are taking into account some feedback on the design, and we'll be probably adjusting some of the things like colors in the next round. And this is just a reflection. This is a marketing message. We're using a graphic. Judge Judy is someone who's tested really well. She's very popular, especially in urban communities. Classic. So we're using this in our social media marketing materials. And just to wrap up, we again are very interested in providing top and emerging questions that we're seeing in the chat logs that you've seen to health departments. And we think an analysis of what we have now, which is 20,000 logs, will identify which responses are most effective. But we're also really keen to make sure that those doing the vaccine outreach in person in real time have a sense of what people's top of mind concerns are, as well as those new and emerging concerns. And two of the ones that we have seen emerging in recent weeks were, does the vaccine cause autism? And we also think that might be something that comes up as vaccines become eligible, children become eligible for vaccines. And this notion of, does the vaccine actually create allergies? So those are two things that we saw come up in the logs, and we'll be looking very closely at as the weeks progress. With that, I'd like to turn it over to Sandra Dobson, so you can hear more about how the chatbot is working to equip ambassadors working in Baltimore City.
Thank you, Rose. Is this On now? Okay. Thank you. Thanks, Rose. It's a pleasure to be here with you guys. Now, you know that I'm not a technical person. I see that there are a lot of people on the call who are from Value Baltimore. Thank you for being here. The work that we're doing is reaching directly out to the community to give answers, assurances, information, and education about the vaccine. We aren't technical experts, but we do use the training that we get from the Baltimore City Health Department and from Johns Hopkins to accommodate the questions that we get from the community. And Vira is a very integral part of that because we can't be all places at all times. Right now, there are 10 value communities targeting certain communities such as young adults, older adults, young men, Latinx population, the disability population, lactating women and pregnant women, and the immigrant community. And we're spread across the city trying to reach people and provide them with the information they need to make a choice about getting a vaccination. Now, engaging with the community is the most important part, I think, of providing information and education. It's one thing to drop off a FAQ at someone's door or to leave it on their car, but they like talking to people. They like developing a trust relationship with someone who either looks like them or understands where they're coming from so that they can trust that the information is secure. We can't be everywhere at all times, so where does that leave us? It leaves us with Vira. Next slide, please. We can go to the, yes. So our strategy is to vaccinate 80% of the residents in Baltimore City by the end of the year. We aren't there yet, but we're working on a triad of getting information out. One is to canvass an area and let people know that there is a vaccination clinic in the area. That's the information part of it. The education part of it is when the ambassadors go out and have face-to-face conversations with people, either to answer their questions or to refer them to a resource. And this is where Vira comes in. One of the resources that we refer is to Vira. And it's a very helpful link because people can sit in the privacy of their homes or wherever and ask a question that they might not want to ask a person face-to-face. So they can go to Vira and get that answer. And then the third step, the third leg of it is to provide information about where the vaccination sites are. So working in tandem with providing the information, providing the education, and then providing the resources for them, whether it's to get a vaccination, to get more information, or to have more conversations with their medical providers. That's part of what we do. Next slide, please. So the mass media campaign is not something that we get too much involved in because, again, our role is to help develop trust with the people that we see. For example, my group, the older adults group, is targeting people over the age of 55. And so most of the people in the team, most of the ambassadors are around that age, some a little younger, some a little older, but they understand the challenges of that particular age group. So that's developing a comfort level in the conversation and the ability to communicate one to another. The team itself is able to go to places such as senior centers or to senior buildings or to churches and have conversations about the vaccine, have conversations about anything surrounding the vaccine from, does my grandchild have to be vaccinated? If my grandchild is sent home from school, what do I do? Do I get the booster shot now or am I supposed to wait? Those are questions we can answer. Then there are questions we can't answer. And again, that's where the resource such as Vira comes into play. Next slide, please. So the techniques that we use, as I mentioned, are the listening sessions, when we can get into a place to have a listening session, because as you know, so many places are still not open to public access. Co-creation of education is, our relationship is with Micah and IVAC. They are able to develop the tools that we need to use when we go out into the community. The ambassadors I've already mentioned are, and I have to say that the ambassadors that have been associated with the program are outstanding. They might have all come to the program with minimal knowledge about the vaccination or about COVID period. But as the weeks have gone on, they have become many experts and have been able to develop relationships within their communities and their target groups, so that when they speak, people are listening. And as people are listening, we are able to provide them with a good basis of education to help them have a sense of trust with us. And that building trust is the most important part. When you can gather the trust of your community, then they respect you, they respect what you say, and fortunately, many of them go ahead and get vaccinated, which is the most important part. We're pleased that this Value Baltimore consortium of teams through Hopkins, Morgan State University, Micah, and the ambassadors have helped to increase the number of vaccinated citizens in Baltimore. We have a long way to go, but I think we can get there if we continue to work cooperatively. And again, I think Vira is a very excellent resource that we use, and the changes that you are making with Vira can only enhance the work that we're already doing. I hope that gives you enough information about the Value Baltimore team and what we're doing. If you see us out there in the yellow shirts, give us a wave, come over and say hi, and know that we're out there helping to protect all of our interests by getting people vaccinated. Thank you so much. I think I will open it up to questions now to the entire group. Thanks to everyone for being here.
Lovely. Thank you, Sandra. We had some questions come in, and it looks like Nour, you covered those pretty well. If you have more questions, please just drop them in. We have about 15 minutes left, so we are all open. I guess I'll start the time off by asking more about that listening component. Now, you mentioned that the listening part of Vira is one of its greatest strengths, the way that healthcare community and workers can gain anonymized input back from people about what they're concerned about in real time. Rose, Sandra, are there any ways that you have seen that listening kind of really support or change the way that healthcare workers have behaved or engaged with their immediate communities? Maybe some specific examples of just like pivots or changes out of the learning from Vira.
I remember one of our ambassadors, one thing is you don't build trust the first time you talk to somebody. If it's a stranger, they're not going to immediately assume because you look like them or come from their neighborhood that you can be trusted. So you start building a relationship by being there and being there and being there again. And for the first, second, or third time, that person might say, no, I'm not getting vaccinated. Second time, I don't think I'm getting vaccinated. The third time, give me the information. And then the next time you see them, I got my vaccination. So it's a layer of building trust. We sent a person to Vira once, we said, if you can't find us, go to Vira, put your question in, and they came back and said they used Vira and it was very effective. So it's, once they trust you, they can trust your recommendations, if that makes sense.
And Nina, I want to also follow up on Sandra's comment. I think we talk a lot about the general community trusting the scientific community, for example. But I think obviously trust, as Sandra was saying, relationships are important and trust is a two-way thing. And I think as the scientific community, apart from looking at the science, we need to have a listening ear to what people's concerns are in the real world and to take people at face value and very seriously and as equals and so on. And, when people are expressing concerns about things, those concerns are valid, first of all. And then they are to be addressed. And so I think the ability of when we look up the evidence to suggest, what is the best evidence-based response, obviously we initially populated the chatbot with the questions that we thought were important. But over time, we're addressing questions that the community thinks are important. And we're able to provide updated evidence-based, disseminated information on the basis of what people are asking for. And I think that in itself is important. And it also, as a vaccine scientist, is humbling for me because, I obviously have my own ideas about things, but so does everybody else out there. And that is just as valid as my perspective. And I think that's a nice reminder for me as a scientist in vaccines to think about what are people's real worries out there. Yeah. Thank you. What can I learn from them, if you like? Yeah.
Thank you. I think that's actually a really interesting segue to a question we have here from an anonymous attendee. Have people expressed hesitations and concerns around the vaccine because of disinformation or rumors they see on social media? I think this was briefly covered, some of the longstanding questions that we can kind of root and source directly back to conspiracy theories or misinformation. But I'm not sure, probably all of you can speak in one way or another to this question, but has anybody seen a direct connection between misinformation that people are getting and the questions that are coming through Vira?
I would just mention that we don't have a way to track exactly where the misinformation came from, but we definitely are seeing persistent and sticky misinformation in our logs as we look through. I think we're hoping that we'll see it in our logs before it appears on social media. So it can be like an early warning system. But when people are feeling like, I heard this really weird thing, I'm not really sure about it, let me just go ask, before they start sharing it and propagating it. So that's kind of our hypothesis, maybe like an early warning system.
And we have had documented events of, very influential celebrities or others proposing some kind of problem. And then we get flooded with questions relating to that problem as well. And we've directly addressed in that situation the source of the misinformation. Straight out named the celebrity as the potential source. And I think it's important to give to address the source of people's worries. That's really important. Yeah.
And when you build a field of trust with the people that you're talking to, you might be able to say to them, "Are you kidding me? Where did you hear that?" And engage them and have them think really seriously about the kind of information that they're asking about. Do you really think that? And again, if they're trusting you and you have a relationship with them, it might, and I've come up against this, it's like, well, yeah, you're right. It does seem kind of loopy, but it points them in the direction of get the facts before you go off half-cocked on the wrong information.
That all makes so much sense. I think what's really interesting about the chatbot is that it is integrated into a suite of in-person and digital, and that feedback loop is just very comprehensive. Rose, maybe you can speak to what the next steps are for the chatbot in terms of research or expanding the target audience. Where's the development going?
Yeah, I guess one of the things that we've noticed is we do get traffic from outside of the United States, our web traffic. Most of our traffic is from the United States, but that's because that's where our marketing has been. But We unfortunately are not equipped to answer questions about vaccines that are given in other countries but not given here. So we would really like to adapt what we have for other settings. For example, India, where there are large numbers of English-speaking people, we've had a lot of of our colleagues ask, are you going to be adapting this in India, and how can we make this happen? Also in English-speaking countries in sub-Saharan Africa, like Zambia, another colleague is really keen to do something there. There's misinformation knows no boundaries, and they're much, people are much earlier in some of these countries in the vaccine rollout. So there's a lot of opportunity to sort of nip these concerns in the bud.
Awesome, thank you. We have a question from Maria Velasquez here. I would like to share about a focus group we did and what we discovered. Yeah, Caroline, I think can turn on your mic, Maria, and you can speak to us directly.
Thank you. My name is Maria, and I work for Telpochcali Community Education Project. And back in August, no, it was in July, we did a focus group of 10 people with the purpose of listening to their concerns on why they didn't want to be vaccinated. And it was interesting because it was just a listening session, and going back to what Ms. Sandra was saying about the trust and the relationship. So we were able to get these 10 people, and it was a safe space and open. And we just said, as facilitators, we just said we want to listen to why you don't want to get vaccinated. That's all we did. We didn't give information. That's the only question, and then everybody participated. It lasted like an hour and 15 minutes, and it was interesting because everyone participated and the rest of us listened. And it was interesting that at the end, 3 of the 10 decided to be vaccinated. So it wasn't something that we said. It was something that happened within the group of hearing each other's on the whys. They didn't want to get vaccinated. That 3 people were convinced at the end of the focus group that they will get vaccinated. So we're trying that again at the end of this month, because right now, presently, there's kind of 2 populations that we're connected to. One population is a population that already has been vaccinated, and the other one, they're convinced that they don't want to be vaccinated. There's no people in between. Is now when we connect with people, it's either one or the other. And there's a 5% of the people that is connected to the organization that they don't want to be vaccinated. So one of the things that we're continuing to do is this focus group, and see if the same thing happens. I don't know. This will be our second one. So I just want to bring that information. Thank you.
That's what a good listening session does. It gives people a chance to hear what others are saying and may assuage some of folks' own concerns. And again, it builds trust.
And the other thing I think that Maria's comments bring out is that in a setting where you have a trusted conversation, it really lets you reflect, and Sandra was saying some of this as well, it really lets the person reflect on what's really motivating them, what is really the underlying concern here. What are the things that if we dig into the motivation to get vaccinated or the concerns around not getting vaccinated, what are the things that belie or that lie underneath really the stated concern? Because things are never only just at the surface, and what people express into the chatbot, may be the external manifestation of a deeper concern, a deeper fear. What we're trying to develop actually, and this is kind of the next level, and Nina, you're asking what are the next developments, we'd like to incorporate motivational interviewing techniques into the chatbot. So it really enriches the depth of the conversation that can be had. It's not only fact-based, tell me a fact, here's a fact. I'm concerned about this, well, here you shouldn't be. But it's really about what are the underlying issues for you in asking that question. Rose, perhaps I know you've thought about this a lot as well. Perhaps you'd like to answer.
Yes, so we do think that that would be a really helpful add-on. And so we're exploring two potential avenues. One would be allowing the chatbot to respond to users who are not decided, have some concerns, maybe some trust issues, and then establishing a motivational interview flow with the chatbot where there would be a series of open-ended questions and the chatbot could help the person reflect on his or her concerns or true motivations, which is part of a motivational interview. So some of the components of motivational interviewing have been effectively adapted into chatbots for other kinds of interventions. And so we're really encouraged about those results and think that there's a lot of potential. We're also looking into whether, as part of introducing a sort of a person, a real person in the loop, if we could refer people who are chatting and are really interested in continuing the dialogue to an individual who could be trained to conduct a motivational interview through chat or maybe even through voice. So we're looking at a couple different potentials, but definitely see listening is hugely important.
All of that is so exciting. I think that dovetails really nicely. Well, I'll take this last question from Robin Kistler. Is it possible to share your logs or trends with new questions emerging, looking forward around boosters and kids under 12? It may be helpful for us to have the timely insights from the inquiries you're collecting. Is there an opportunity for attendees to gain from some of the insights you're learning?
So the answer to that in principle is yes. The data are de-identified and they can be made available. Obviously, we are ourselves also thinking through that analysis and hoping to also publish from it. But beyond just, and as an academic exercise, beyond that, the idea would be that it would be a resource. One thing that we're exploring, but we're not yet able to do, but I think it would be a really neat idea if we could, would be to be able to, in theory at least, if we could locate, at least in broad terms, where the people are who are asking those questions, then we could sort of split up the analysis into jurisdictions. And so for health departments, that might be really interesting. That we know that states across the United States differ in vaccine uptake, and the concerns across states differ by lots of metrics and for lots of reasons. And we could potentially develop a more tailored response for health departments if we have that capacity. It's technically challenging to do that. And there are some ethical questions that it raises also. So I think it needs to be addressed carefully. But certainly we would want to see the information that's gathered as part of what's a benefit about from this, and really to start to raise the flag, as Rose mentioned, that we get an early signal for concerns, perhaps even before they appear in social media. And if we can address them in the chatbot, and if health departments can address them, then we can be a step ahead instead of a step behind where people's worries are. Thank you.
Wonderful. Well, I think we will all be very excited for when the team reaches that step. Thank you all so much. This has been incredible, just from technicalities to the application to the future of Vira. Thank you also to the Rockefeller Foundation for supporting these webinars. And to our attendees, thank you for joining us. We'll be sending out a recording and mentioned resources in an email within the week. And as a last note, many of you with us have been joining since January, since our earliest surveys on testing and vaccine attitudes or public attitudes toward those things started. We're releasing our latest wave of data at our next webinar on October 20th, same time, on how public attitudes on the pandemic have changed or stayed the same in really surprising ways. And we'll also be sharing findings on the messaging proven to work to encourage positive health behaviors. So again, that's 4 p.m. Eastern time, October 20th. So thank you so much. Thank you so much again, all of you, and see you soon.
Thank you, everybody.
Thank you.
Bye-bye. Take care, everyone.
Thank you.